Founded in 1879 by 8 physicians, UAMS is the state's only health sciences university with a mission to improve the health and healthcare of Arkansans.
The state is truly dependent on our mission to improve healthcare, to train healthcare professionals, and to discover treatments and cures for health problems that afflict the 3 million Arkansans. We trained the vast majority of the healthcare professionals who practice here in the state of Arkansas. Between ourselves and our partners, the VA, Arkansas Children's Hospital, we contribute over $4.5 billion a year to the economy of the state of Arkansas. We're the largest public employer, over 10,000 employees scattered across the state. We're not just in central Arkansas. We have footprints in 73 out of the 75 counties in Arkansas. We have relationships with 165 hospitals and other healthcare entities within the state.
UAMS is educating the next generation of healthcare professionals through our 5 colleges and graduate school.
The primary goal UAMS has is to educate the future healthcare workforce for Arkansas. And our goal is to have each of these practitioners enter the workforce ready to provide patient and family-centered care in a team-based, interprofessional manner. We have over 70 degree programs. We have 2,727 students in our 5 colleges: public health, pharmacy, medicine, nursing, health professions, and also a graduate school.
When it comes to high-quality, innovative, patient and family-centered healthcare, look no further than the UAMS Medical Center, Specialty Institutes, and Clinics.
UAMS contributes to healthcare across the entire spectrum of healthcare. Everything from world-class primary care to tertiary and quaternary programs that are not offered anywhere else in the state or even within the region. The gem are the people and the programs that we've put together. To have such highly qualified specialists who've trained not just here but in some of the best programs in the world. The development of a comprehensive stroke center, the first and the only in the state, and to have the state's only level 1 adult trauma center is really an important resource for every citizen within the state.
Patients from around the state and around the world come to UAMS for expert treatments and care.
My name's Dottie Lobbs, and I live in the small community of Brush Creek near Leola. In the summer of 2015, I started just feeling really, really tired, and I called the doctor. I said, something's wrong. We told him we need a referral to UAMS. So we went in and we saw Dr. Vera Puthrin, and he told me that I was going to have 3, probably 4 rounds of chemo and then a transplant. And I was very, very lucky because they had just started doing transplants in August of 2015. Otherwise, I would have had to go out of state. The transplant program at UAMS is one of the most wonderful things that Arkansas has.
Research at UAMS has a goal of advancing discoveries in human health and disease and translating them into health improvement. In fact, UAMS research ranks among the top 16% of all U.S. colleges and universities in research funding from the federal government.
Many people that aren't in this business don't really understand how competitive it is to get research funding, particularly from federal agencies like the National Institutes of Health, but also from foundations such as the American Heart Association or the American Cancer Society. So our investigators compete very well. Research is a critically important part of any university or any academic health center. Research translates into innovation, it translates into new treatments, new discoveries that have the potential to improve human health.
The UAMS Winthrop P. Rockefeller Cancer Institute aspires to become Arkansas's first NCI designated cancer center, which would mean expanded services and access to more clinical trials and therapies not currently available in the state.
The NCI designation is designed to help the entire state. One reason that you want to become designated is because you have options with treatment options for patients that otherwise you wouldn't have, and then there is a very large amount of funding for research. Overall, the center has to reach a goal of having $20 million of research funding. We have a very well-known myeloma center that has patients from around the United States, all 50 states, and from many countries. We had invested in the myeloma center, and that's an example of what can happen when we have the proper investments. The NCI designation brings new researchers, new people to help the researchers, and the economic impact to Arkansas is somewhere around $70 million a year if we get NCI designation.
In addition to Central Arkansas, UAMS is working to improve the lives of community members through a regional campus in Northwest Arkansas and health and education centers located across the state.
Collectively, across the state of Arkansas, UMS Regional Programs is comprised of approximately 650 employees. This includes faculty, staff, and resident physicians. Across the state, we're credited with approximately 150 residency training slots. We affiliate with the various teaching hospitals in those locations. So the primary care gain really improves the potential for improving outcomes for the state of Arkansas, which reduces costs, improves quality, and creates efficiency in management of care better.
We have had growth in each one of our mission areas. In total, we have 250 students. Each of the academic colleges have activities and students in Northwest Arkansas. Our program in physical therapy has 72 students, and it just graduated its first group of students this past May. One of our biggest accomplishments is that we had 100% pass rate of that first year of students. Only 8% of all the programs in the U.S. have a 100% pass rate, and it's rare, very rare, for a new academic program to have a 100% board pass rate. Building upon the success of physical therapy, we have partnered with the University of Arkansas Fayetteville campus to develop an occupational therapy program. This program will begin enrolling students in 2019 or 2020.
I've appreciated a lot of things about being a part of the PT program here in Northwest Arkansas. It's been a lifelong dream of mine to become a PT. I think the UAMS Northwest campus can improve the region in so many ways. We have so many innovative research studies going on, and we have so many healthcare professionals coming in and graduating and hopefully staying here that we are able to fill a need and a void that has kind of arisen in this area.
One of the things that distinguishes an academic medical center from a non-academic hospital is our conviction that we are here to serve people not just today, but tomorrow and the next day. That's in our genes. That's what we do. And the work that we do today will ensure that kids born here in the state will be healthy growing up, will be less likely to be afflicted with chronic health problems like hypertension and obesity. Those are big challenges, but those are the kinds of challenges that excite us as UAMS team members.
Through advanced healthcare, world-class research, and high-quality education for our future healthcare leaders, UAMS is delivering a better state of health for Arkansas and beyond.